In progress.
Hello, everyone. Good afternoon. Thank you for joining us. This is our weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Virgili, Hispanic Public Information Officer. And joining us today, also as special guest, is Dr. Keisha Davis, the county's health officer, as well as Dr. James Bridgers, Director of the Department of Health and Human Services. And I see Ms. Luisa Cardona, Assistant Chief Administrative Officer, also joining us. Thank you, everybody. Mr. County Executive, the court is yours.
Thank you all for joining us again this week. So, no surprise, let's start talking about what's going on with the Trump administration, because it's always interesting. Trump administration and officials have been sowing confusion and dubious claims about vaccines. And this week, Trump and his HHS secretary, RFK Jr., again, somebody who knows nothing about science or medicine, asserted a link between Tylenol and autism. There is no solid peer-reviewed science that supports the proposition that Tylenol causes autism. Yet it's being presented in a way that blurs the line between speculation and fact. That causes fear, chaos, and mistrust among parents. It puts parents in this unpleasant situation of wondering whether if they took Tylenol while they were when they were pregnant, did they cause their child's autism? And to do that and insert that kind of fear into people when you do not have the facts is something the president and RFK should not be doing. It puts doctors in an impossible position. How do you advise someone when the federal leadership seems to be issuing statements that aren't backed by science? To bring clarity to vaccine guidance, Maryland and other states have joined the Northeast Public Health Collaborative, a multi-state coalition formed to develop vaccine recommendations and other public health guidance to combat confusing and, frankly, not true messages coming from the Trump administration. Montgomery County stands with the Maryland Department of Health on the importance of vaccinations to help reduce the burden of COVID, flu, and RSV in the community. And now, adding insult to injury, health insurance costs are going through the roof. Across the healthcare marketplaces, insurers have proposed median premium increases of about 18% for 2026. For those of you who follow inflation, 18% is like more than 12 points higher than inflation. It is unjustified, just unjustified. If Congress does not extend the enhanced premium tax credits, federal financial help that makes these plans affordable for many will expire at the end of 2025. Then bills for lower income earners could more than double. And clearly that would mean fewer people choosing health insurance and putting to use the most expensive healthcare option, the emergency room. And that's a cost shared by many of us. It's also a cost that puts an enormous pressure on hospitals. When they are saddled with patients who could be treated and not use space in the emergency room, but because they have no other alternative, it just drives up the cost of health care for everyone, and it endangers many hospitals' financial stability. So to put it all together, mixed or contradictory guidance about vaccines is confusing people who just want to make a safe choice. Unscientific claims about health risks like Tylenol and autism are being made with huge visibility, and insurance costs are skyrocketing, and many people depend on the exchange plan to get basic medical care. The outcome is leading people to skipping care, delaying vaccinations or treatments, or being priced out of insurance entirely. It breaks trust, it undermines public health, and it contradicts the oath doctors swear, which is, first, do no harm. Maybe RFK Jr. doesn't think that applies to him because he's not a doctor. That's a poor excuse, though, since he's still a policymaker. We need policy based on science, transparent evidence, and responsible communications. We need leadership that doesn't stoke fear, but instead supports patients and clinicians with clarity. When the federal government issues statements, it must be aligned with the science, and Congress needs to act so that people relying on health insurance marketplaces aren't left completely exposed by disappearing subsidies. Because without that, the confusion, cost, and harm is only going to grow, and the burden's going to fall on the most vulnerable of us. This week, I've asked the county's health officer, Dr. Keisha Davis, to join me to discuss these issues. In addition to having a lead role in advising policy in my office, she's a practicing family physician. So thank you for joining us today, Keisha. The floor is yours.
Thank you, Mr. County Executive. I want to start by just saying it's been a difficult week for public health and the medical community. The rapidly changing guidance from the federal government on vaccines has been frankly head spinning. The pace of these announcements, often not grounded in science or facts, has created confusion for families, frustration for health professionals, and concern for those of us who have dedicated our lives to protecting community health. I remind folks I am a family physician, and frequently in conversation with the other health officers across the state, as well as other family physicians and professional organizations across the country. And I want to be very clear. The scientific, medical, and public health communities base their work on rigorous training, data analysis, and evidence. That expertise should not be discounted or overridden by political voices without the same experience. Health decisions deserve careful review of the best available science, not sound bites or quick fixes. My commitment to you as health officer is to provide clear, transparent information grounded in evidence and to keep your health and safety at the center of every decision. So I want to start first and foremost. Vaccines do not cause autism. This is the consensus of the medical and scientific community built on decades of research. Numerous well-designed studies have found no causal link. The original study that suggested a connection was retracted and found to be fraudulent. Vaccines remain one of our most effective public health tools, preventing serious illness, hospitalizations, and death. Undermining vaccine confidence puts everyone at risk. Here in Maryland, I applaud the steps that have been taken by our Governor, Wes Moore, and Secretary Session-Mounty to ensure continued access. Insurers in Maryland will continue coverage of the recommended vaccine schedule that was in place as of December 31st, 2024, and COVID vaccines remain available in pharmacies and doctors' offices without a prescription. There is also a standing order that has been issued to make them available, and they continue to be covered by insurance. Turning to acetaminophen or Tylenol, the American College of Obstetricians and Gynecologists has reaffirmed that it remains safe and important in pregnancy when used appropriately. In addition, the American Academy of Pediatrics emphasizes that Tylenol is safe for children when taken as directed. There has been some recent studies that have raised questions about possible associations with autism or ADHD, but association is not causation. The overall evidence remains inconclusive, and professional medical groups continue to recommend acetaminophen as the safest choice for fever or pain during pregnancy and childhood when needed. We must also remember that untreated fever or pain, especially in pregnancy, can pose its own risks and can increase complications for both the mother and the developing baby. It is important that we treat fever in pregnancy. We know that the outcomes of untreated fever can be quite harmful. Finally, leucovorin, which is a form of folinic acid, has been suggested as a possible treatment for certain autism-related symptoms. And while small studies show promise, larger, well-controlled trials are still needed. Autism organizations, including Autism Speaks, caution that leucovorin should not yet be considered a proven or routine therapy outside of research settings. So based on current evidence, I recommend continue to follow the recommended vaccine schedule. It is safe and effective. Pregnant people and caregivers should consult with their doctor before taking any medication, and acetaminophen, Tylenol, remains the safest option when used correctly. Avoid unproven therapies like leucovorin outside of clinical research, and be skeptical of simplistic explanations or single drug cures for autism. And rely on trusted sources like the American Academy of Family Physicians, the American College of Obstetrics and Gynecologists, the American Academy of Pediatricians, and established autism organizations for guidance. As I wrap up, I want to take a moment to just acknowledge what all of this means for families. And I know that many parents or caregivers just want to do the right thing for their children. I'm a mother of 3. I know how much you want to make sure that you're doing the right thing for your kids. And the confusion that has arisen from all of these conflicting headlines and evolving research and misinformation in the vaccine space really makes it hard for families to feel confident in their choices. I want to affirm that Those concerns come from a place of love and responsibility, and that is our role as public health to help you navigate this landscape with clarity, compassion, and evidence. At the same time, it's essential to speak directly to and about the autism community. Autism is not a disease to be eradicated. Neurodiversity is part of the rich spectrum of human experience. People with autism bring unique perspectives, strengths, and contributions to our communities. The focus should not just be on searching for a cure, but on building a more inclusive society, one where every individual has the opportunity, support, and respect they need to thrive. For every complex problem, there is a solution that is clear, simple, and often wrong. Autism is a profoundly complex neurodevelopmental condition, and oversimplified explanations, such as blaming vaccines, acetaminophen, or proposing single drug cures, ignores the depth of scientific evidence and does a disservice to our patients and their families. In many ways, the cure is already within us in how we choose to treat one another. It's our ability to show empathy, reduce stigma, and recognize each person's potential, and to ensure that children and adults with autism are empowered to live their best lives. So as we move forward, let's commit to not only grounding health decisions in science, but also grounding our relationships in compassion, which is how we build healthier, more inclusive future. In closing, my responsibility as the health officer is to rely on rigorous science, not fear or speculation, and I commit to transparency, to monitoring new research, and updating our guidance as warranted by evidence. Thank you for the opportunity to address the county.
Thank you, Dr. Davis. I see that Dr. Stoddard, our Assistant Chief Administrative Officer, also joined the call. Members of the media, any questions for Dr. Davis at this time regarding this topic? Please raise your hand. I see Lionel Donovan, WUSA 9. Go ahead. Good afternoon.
Good afternoon. Thank you so much. And thank you, Dr. Davis, for your time. I just wanted to ask you, as someone who is a practicing physician here in Montgomery County, what have you been hearing on the ground from parents who, have any of them come to you saying like, hey, I've heard President Trump saying this, or Health Secretary Kennedy, saying that? Like, how is what, has been coming down from the federal level, how is that impacting, your ability to practice, and other physicians who might have to deal with this, this misinformation coming from federal leaders kind of on a daily basis?
Collectively, what I hear from, patients and my colleagues are fear, frustration. Many in the community have spent a lot of time dealing with feelings of guilt about, was there something that I could have done? Was there something that I should have done differently that caused my child to be, to have autism? And want to offer folks what the research shows is that there are a lot of the overwhelming evidence is that there is a genetic link to autism. And there is no one thing that someone did that caused their child to have autism. And I think a lot of this is just helping to hold the hands of patients who are feeling confused, whether it's around autism or vaccines or hepatitis B. Having that trusted voice of your, primary care clinician to help you muddle through all of the different information that's coming out.
I just had one follow-up question kind of on that same topic. Given, the statements made by Secretary Kennedy over the past couple of weeks and months, have you noticed that it's been harder for you or other physicians to make sure that parents properly vaccinate their children? Have you noticed that, that you're having to work a little harder to let parents know that it's okay to vaccinate their children, or, fewer parents are coming in to vaccinate their children because of what's being said from the Trump administration?
It's happening so fast that I don't know that I've seen changes yet. I will say that I'm reassured when looking at a population level of vaccinations of kids coming into schools. MCPS just had the cutoff at which kids need to be vaccinated to be able to stay in school. We were somewhat concerned because the number of kids coming to the county-run vaccine clinics was down. But when we look at the numbers of kids in school vaccinated, those rates are on par, if not a little bit higher than where they've been in previous years. So people may not be coming to the county clinics to get vaccinated, but they are absolutely still getting vaccinated, and that is reassuring, and that is what we care about the most. So I think what a lot of this has done is encourage folks to go get those shots, and maybe they're getting them, at their primary care offices or with pharmacies. So I am encouraged by those numbers.
Thank you, Doctor.
Thank you, Lano. Members of the media, any other questions for Dr. Davis on this topic this afternoon? No more questions on this topic. Well, I believe you'll remain on the call, Dr. Davis. Mr. County Executive, other topics?
Well, staying on the Trump theme, and thank you, Dr. Davis, for your comments. You are always on top of these things, and I do appreciate the passion and that you bring to this. It goes with your work, and it shows in everything you do here. So thank you again. Other news that's going on, Trump is now issuing threats and continuing to be a bully. He's now threatening mass firings, layoffs, if Congress doesn't keep the government open, but open in a way that he approves of. In other words, if he doesn't get what he wants, he's going to have a tantrum that will wreak havoc on people's lives and on the operation of important government functions. He has ordered departments to prepare lists of people that they're going to let go on October 1st if he doesn't get what he wants. And this is just more stunning and scary stuff. We're faced with a president who's unwilling to work with people and unwilling to negotiate, and will continue to create mass misery and destruction. And quite frankly, it's unconscionable. The cuts in his budget are going to be devastating to the American people. Some of the worst cuts they cleverly are going to disguise by not having them take effect until after the 2026 election. But they're looming out there, and some people may not feel the worst of this until the election's over. And it's just the kind of deceptive, duplicitous thing that we've gotten used to. Speaking of this deceptive and duplicitous behavior, Trump's appointees in the housing arena, Department of Housing and Urban Development, are rolling back enforcement of fair housing laws. And some people might wonder, is there any connection between Donald Trump and fair housing? And lo and behold, there is a connection. Donald Trump and his father, there was a lawsuit in 1973, Department of Justice, United States versus Fred C. Trump, Donald Trump, and Trump Management. And in October 73, the Department of Justice filed a civil rights lawsuit against Fred and Donald Trump and their company, alleged systemic racial discrimination. The key allegations were Black applicants were denied apartments or falsely told that none were available. White applicants were offered units in the same building. Trump employees allegedly used coded markings on applications to indicate the race of the applicant. And Trump was managing 39 buildings with over 14,000 apartments in New York City. Of course, the Trumps denied wrongdoing, and no surprise, they sued the government for $100 million. There's a theme here, I think. That claim was dismissed. There's also a theme in that. In 1975, this case was settled with a consent decree. There's no admission of guilt, but it required the Trump management to advertise to minorities, report vacancies to the Urban League, and to cease discriminatory practices. The Department of Justice called it one of the most far-reaching housing discrimination settlements at its time. So with that as his background, you have some sense of why he's now taken advantage of his presidency to roll back the laws protecting fair housing in general. It's just another threat to people. It's racially motivated. It kind of further cements his role as leading American racist in a high political office. And it's just disturbing that he continues to find ways to hurt people. I lived through Richard Nixon. Vietnam War and all the stuff that went in between, then nobody has come close to the willingness to cause harm to people that this president has done. On a brighter side, there are new laws starting in Maryland on October 1st, and we have some notable changes in laws that take effect on next Wednesday. I'd like to run through a few of them right now. One of my favorite, the Lowering Prescription Drug Costs for All Marylanders Now Act, helps boost the power of Maryland's Prescription Drug Affordability Board. That board was set up to set upper payment limits for drugs that are sold in the state. and it will now work to bring down the cost of some of the most expensive medications. I can tell you that this is important for the county, not just Montgomery County, every county in the state, and for the state government. Drug costs are a major part of all of our insurance costs for our employees and for our retirees. As drug costs spiral out of control, our insurance costs are going up with them, and the ability of the Affordability Board to control prices will be an immediate benefit, long-term benefit to the county and to our taxpayers and to anybody who has to buy drugs on the market. So this is really important legislation, and it's one of the great things that I, give a lot of credit to the state legislators who led the fight for this. It's really important that they did this. The Maryland Online Data Privacy Act is also going to set new rules for personal data collected by companies that we do business with. The new measure will give consumers the right to opt out of data sales and targeted advertising. Consumers will be able to access, correct, and delete the personal information a company collects. And data protection assessments will also be required of companies for activities that are considered high risk. Other measures that were passed will strengthen laws against secretly recording or watching someone through video surveillance without their permission. It will force companies that offer subscriptions with automatic renewal to provide consumers with a way to cancel easily without costly penalties and make it illegal to add medical debt to someone's credit rating. Criminal investigations into theft rings should also get a boost. New laws will aid in the prosecution of organized retail theft by allowing police to combine multiple theft incidents committed across different counties into one criminal case in any county where a theft happened. And the magnitude of this is a big deal because instead of having to file suits everywhere and try to prove guilt everywhere, they can take all these cases and put them into one big one. And this should, I think, help tighten control over the theft rings that are out there now. We've also spent a lot of time over the last few years talking about the Sergeant Pat Kept Act, and part of that law will go on the books in October. There will be additional penalties and points assessed against a driver convicted of reckless, negligent, or aggressive driving. The criminal justice system adds more offenses to the distinctions of what makes reckless and aggressive driving. Also starting on October 1st, there'll be new safeguards to help vulnerable people in the Adult Protective Services system. Confidentiality will no longer be a valid reason not to report abuse that a person has witnessed. And hospitals will no longer be able to sue patients over medical debts totaling less than $500. And housing covenants won't be able to restrict the operation of family child care businesses or others that put undue limits on them. Landlords and property owners will be limited to no more than 5% of unpaid rent when assessing late charges. So late charges will be limited to 5% of the unpaid rent. New traffic safety laws will go into effect October 1st. I plan on attending a media event in Wheaton next Tuesday where county leaders will detail those updates and discuss how they relate to our Vision Zero plan. Our highest priority remains safety for everyone who uses the road, and that includes pedestrians. And getting drivers to slow down is imperative in keeping more of our residents safe. So those are important things that passed the legislature, and you'll see going into effect on October 1st. In other exciting news for Wheaton, this morning I was in Wheaton for the opening of our latest oak barrel and vine location. It's inside Westfield Wheaton Mall, near the Costco entrance. It replaces the former store on Georgia Avenue. This is the 6th store to carry the Oak Barrel and Vine name. And from now through Sunday, we'll offer special wine and spirit tastings. Opening of these upgraded stores across our county has been well received. They offer good selection, value, and service. Montgomery County's Alcohol Beverage Services, or ABS, generates over $35 million in net profits annually to the county to fund county services. In other words, profits they make offset about $0.015 in taxes we would otherwise need to raise this amount of money. By reinvesting in our communities through stores like this, we're supporting local products and ensuring that ABS continues to provide real value for Montgomery County residents. The ABS is also the wholesaler of beer and wine and spirits in Montgomery County. It operates 27 retail stores throughout the county. So we both provide wholesale beer and wine to all the beer and wine stores you see out there, as well as operating our own retail stores, and only county stores sell distilled spirits. In addition, ABS manages alcohol licensing, enforcement, and education for more than 1,000 businesses. The county uses ABS profits to pay down county debt, with a large portion deposited in the general fund to pay for resident services that otherwise would be funded by county tax dollars. ABS also plays another role in our county, helping to prevent underage drinking. So I think, I've always believed that they do a lot to make sure that alcohol use in Montgomery County is done both safely and responsibly. And one thing I know about the liquor stores, and in comparison to private stores that I knew about when I was growing up and when I was over in the College Park area, these folks have no incentive to sell to drunk people. They have no incentive to sell to underage people. Our stores are committed to keeping people safe and following the law. And because nobody there is driven by the profit motive, no one's trying to figure out how to exact the last possible sale. Other news. Last weekend, our Animal Services and Adoption Center put out a call to help clear the shelter of big dogs because of capacity issues. More owners are surrendering their dogs and fewer pets are leaving the building. Because of the situation, we're asking anyone considering surrendering a dog to try all the other reasonable outlets first, like asking friends and neighbors if they're willing to take a pet. During tough times like these, the animal services professionals in the county are committed to helping both individuals and their pets. And that's why we've partnered with Home to Home, a shelter intake diversion program designed to help shelters and rescues reduce the number of dog owners surrenders in their facility. Home to Home is a unique direct-to-adopter tool for pet owners looking to find a permanently new home or a temporary foster home for their animals. This program helps pets find a loving new home without ever seeing the inside of a shelter. And through this collaboration, we're able to provide free courtesy listings for pets in the community who are searching for new homes. To visit, list a pet, or search for a pet in your area, please share with your audiences home-home.org. And please also share our county shelter site, montgomerycountymd.gov/animal services. We'll put both of these in the websites in the chat. Other good news from Montgomery County, I want to recognize the accolades that two of our cities just earned in the Travel and Leisure magazine. They asked real estate experts along the East Coast for the best places to live, and Bethesda and Silver Spring both made the top 10. Bethesda ranks number 6 for its mix of downtown and residential benefits. Trails and parks also helped it to score high marks. Silver Spring was recently listed as the number 1 place for families to live in the nation. And on this list, it landed at number 10. It was singled out as one of the best areas for first-time homeowners across the DMV. Many people think Bethesda and Silver Spring are their own municipalities. They are not. They're run by the county government and supported by 2 of our 5 regional service areas. I want to send appreciations to the staff at Bethesda and Silver Spring Regional Services offices for their work, and to Visit Montgomery for raising up our community. So you can go check out visitmontgomery.com for more interesting news about the county. Before we open it up to questions, I'll give my staff an opportunity to provide any updates they want to share. And after that, we'll start with our healthcare team and go to questions after that.
So thank you, Mr. County Executive. I want to echo your comments. Thank you, Dr. Davis, in your many roles for always using evidence-based clinical trials in the work that you do as a physician, a health officer, and even the agency's chief medical officer. So we appreciate your guidance and all that you do, and I know you will hold true to that. Secondly, Mr. County Executive, I want to thank you as well for agreeing to join our mobile crises outreach team. You know, we were able to ramp up considering all of the behavioral health challenges we have during these unprecedented times. And I appreciate your willingness to join our mobile crises outreach team and our chief of behavioral health and crisis services, Ms. Monica Martin, to really see our work in progress and see the work that we do throughout the county. And so under your initiatives, we were able to ramp up our mobile crises outreach team to have 7 to give us a broader reach in the community. And lastly, I will, as I do every week, leave the number for our mobile crises outreach line, our crisis services line. That number is 240-777-4000. Our crisis service line is available 24 hours a day, 7 days a week, 365 days a year. So thank you and appreciate all the support you continue to give the Department of Health and Human Services. Dr. Davis.
Thank you, Dr. Bridgers. Echo all of those sentiments. I just want to go back to one thing that the county executive mentioned in his comments earlier around changes to the marketplace insurance. And I just want to encourage folks, many people have a marketplace insurance plan and don't know it, and those subsidies could potentially change. And so I would encourage folks to check your plan, see if you are receiving a subsidy and how that subsidy might change and your cost of insurance might change if those subsidies were to go away. We feel health insurance and health care access is really important, so check that. And if you are at risk for your subsidy going away, you may want to reach out to your congressional representatives to tell them how important it is to keep it.
Thank you, Dr. Davis. Members of the media, we're going to open it up right now for Q&A. General topics, please raise your hands.
Hi, there is one thing I did want to bring up. There was a conversation that I was having with another pediatrician in another state, and they were talking about how what's been coming down from the White House and the Trump administration, in their opinion, was dangerous to a point where they were actually advised not to follow federal guidelines. I was wondering if that's something that Montgomery County is also prepared to advise physicians in the county to do. If you are also talking about not following along with the federal guidelines and mandates that are coming from, Secretary Kennedy or anything like that, is that something that could be happening here?
I'll say what we've been doing is we've been trying to stay very much aligned with the state. The state has joined the Northeast Public Health Consortium around vaccine evidence and following folks like the Vaccine Integrity Project and the medical society. So I don't know that we are coming out with a strong statement for or against what the federal government is doing, but I can be clear on what evidence we are following and what is guiding our decisions. And we are staying very much aligned with the state and professional medical organizations.
Actually, thank you. And Executive Ellis, I would ask, from a county government perspective, is that something that you all are kind of following along as well as saying, kind of advising parents or advising guardians to follow what the state is saying and maybe not put so much stock into what's coming out of the federal government?
I'd put no stock in what's coming out of the federal government. I put my stock in health professionals. It was the health professionals who led this country out of COVID. It was the health professionals in Montgomery County who gave us the guidance during COVID and, helped us make sure that we prioritize vaccination. It's one of the reasons this county had some of the lowest death rates and case rates in the company, because we chose to do things that were consistent with what the medical advice was. We knew back then it was wrong to listen to people who didn't know what they were talking about. It's still wrong to listen to people who don't know what they're talking about. If you want advice, get it from a medical professional.
Well said.
All right. Thank you so much.
Thank you, Lionel. Members of the media, any other questions this afternoon for the county executive and the health team? No more questions this afternoon? Thank you for joining us. Stay safe, and we'll see you next time. Have a great afternoon.
Take care, everybody.